Welcome back, folks, to another deep dive special episode of the Digital Nexus podcast. I'm here with Chris.
How are we going?
Mate, it's been a while. We've been very busy. People would have maybe noticed the 100 people that have subscribed. Is it 100? I don't know.
100,000?
Yeah.
100,000? No, that's not.
Maybe would have noticed that we hadn't filmed the news and AI insights kind of things that we do and updates for the last couple of weeks because we've been busy.
We've been filming other things.
We have been filming other things. There was this big hackathon. If you know this home vibe coding, that's what this was all about.
There's some love it, some hate it.
Well, speaking of love it, Lovable,
Cursor,
Windsurf that was acquired by OpenAI.
Yep.
Bolt is the one that we're using. Even like Google has their own vibe coding tools, and others are creating like their own vibe coding tools. But we did this thing with Bolt. It was $1 million in prizes.
In total prizes, that's right.
Total prizes.
Not to be confused with a $1 million prize. Which
Yeah.
At first, when I saw it, I was like, whoa, $1 million. Oh man, I'd love to win that.
Yeah, exactly.
It's not.
It is not that. So that would have been fun. So we decided to go down and do this Bolt Hackathon, obviously for the funds that were there, but also just because there was problems that we saw that we could tackle, and we had the help of a friend named Sal. And you'll see more of that in a video that we've shared there, that we had to do like a quick 3-minute video of the problem that we were solving.
Yeah.
But what do you think about it? What can you tell the people about the thing that we were looking at as our Bolt Hackathon?
Yeah, well, I mean, it was really interesting, as you said, having a chat with both Sal, who's experienced in this space. Health is the space that we were obviously addressing. And even you had some great conversations with people in the industry specifically as well. And they were all showing us, and like literally showing us platforms, talking about the experiences that they were having in that particular space.
Yep.
Of the disconnection of data for both the specialists or GPs and practitioners alike, and also the pains that consumers, as what we've been calling them, but essentially patients, have been going through trying to collect, share, understand the history of their own health information and data. And so that became a real focus for us to try and solve in this hackathon.
If you have a body, a meaty flesh bag, as some might call it, you're affected by this. Like whether you're a provider or working in healthcare, specialist, allied health, nursing, admin, whatever it is, you're affected by health, obviously, because you're directly there. But even everyone else is affected by it. We've all got our own health journeys, whether we've got young kids, whether we've got just ourselves, our partners, our parents. Everyone has to go through the nightmare, I would say, of like going through like what it's like to tackle all the administrative burden of like all your health data, or even just at the hospital and the GP levels of being able to access data. It's not easy. And so these were some of the themes that we brought up.
And it's interesting you said that. So I had a conversation with someone who had seen the application and was really excited by the idea that we were doing, and had a conversation with one of his friends about it, who actually specifically works in that space on the specialist side of things.
Nice.
He said the one issue that kept bumping into when they were trying to solve this particular problem, and Australia specifically, was that providers are actually legally required to safeguard a lot of their patient data.
Right.
And so they don't want to share everything with their patients, nor do they want to share it with other providers without getting some sort of incentive or payment. Right. And so that's, but the government, they haven't done anything to try and unify that system specifically on like, the GP and the specialist side of things. They have inside of your chemists and your pharmacies, they've done a really, quite a good job, particularly with My Health and stuff, to unify that data and make sure it's accessible. But on the, hospitals and those other things, they haven't done anything there to do it. And so it's become a very, I own my data, I want to keep it safeguarded, as a lot of businesses in industry do. And this is where we've seen a cool opportunity to try and switch that around. I'm looking at platforms that they're currently using, like it looks like it's something from the 90s that they're bringing information from all over the place, trying to understand patient history.
So much info on that.
And a really non-simple way to pull together and visualize and see in one shot. It was been a fun project to try and work on in Bolt.
Yeah, and the other thing is that a lot of the tools are made much more available, regardless of how they look. Let's say people get used to it and stuff like that. So that's fine. That I'm sure that they were cutting edge at the time, and there's even newer tools that are coming out there that are more user friendly. But a big problem with a lot of those tools is that they are there for the providers, for the hospitals, for the network. They're not really there for the patient. And
Yeah.
so we decided to flip the script a little bit and actually put the power of technology in the hands of the patient. And so what you can see on screen here is something, and we'll go through more of like how we went through it and designed it. And this isn't the first episode of this. We'll dive in deeper further, because we're actually going to try to turn this into something. So hackathons inspiring actual kind of use cases is cool. So you can see here Health AI that we built, a bit of a homepage on it, some made up testimonials. I wish they were real, but we only had literally 30 days to do this.
And those, as I said, those 3 boxes there that we've got
Yeah.
fleeting on the right-hand side, they're really important because they became the sort of the pillars of how we were trying to, to focus on and pull everything together. First one being, control of your data and your information, your history of your whole health experience for you and your family, or I mean, if you have friends that you might be helping as well, have that on one-stop shop to be able to control, manage. Second one being the security and sharing of your data. So be able to give it to the people that you choose to give it to, rather than someone having that and you not knowing who or what it is. Now you can control who has that information, i.e. specialists and medical practitioners alike. And then the final one being empathy. And that looking at the connection between both the patient and the specialist, and having that specialist have the right information in front of them really quickly, being able to understand the history and what that patient is going through, to be able to build a faster and better rapport so they can make the right decisions.
And as you can see here with the app, and this is what the folks at Bolt that are judging this have access to. So we pause on further development here, but you've got a patient login and then provider login. I'm going to log in as a patient. We've got some test user accounts that we created for this. And immediately you have this dashboard of information here. I can see an about me, my upcoming visits, my tasks, my medications, and click into those tasks to go into the different sections. But in this case, the user is a parent. This parent has a couple of children, has Mia Rose and has Oliver James. And you can see their details too, because this app allowed us to create sub-child accounts. And what we took into account was that children are not going to have emails. They might, but for the protection of data, we didn't want them to have their own login. This is controlled by the parent. And so the About Me section has things here where you can click and go into your profile. You can also see conditions. You can also see medications. And I am here as the child. I can go back and see my own, and you can see the information change there on screen. But what was important, Chris, was that that's cool that you've got your own stuff there that you can keep track of. That's already a useful kind of feature. But the important thing was being able to share this kind of stuff with GPs.
Exactly.
So
Touching
having
on
a
a separate
way,
point.
yeah, exactly. So medications and conditions are what I showed you there. I'm on my user account, so I can say, well, I want to share my condition about ADHD with one of these various providers here, and I can see as well which of the conditions I've got. I've just got ADHD in this case as the parent. The child, one of the children has a couple of conditions, and we can see if they've shared it with specialists, with other GPs. So when the GP logs in, they will see that these things have been shared with them. And just that access is part of that empathy side of things, right? Like being able to see all this kind of information. So that was like one major feature, like having a simple interface where, and yes, it works on mobile, that people can add things. And we see here documents and tasks. So I'll just go into that next. But what did you think about all of that just to begin with?
I mean, it's exactly everything we wanted to touch on in terms of the important factors. And looking at it, we're going on a journey with this. Like the hackathon was essentially our beta, and so we will be changing and altering this as we talk with more people and actually make something that is going to be more market ready. But it touches on that crucial element of what's my history, where's my data. Okay, I now have control of it in this one space. What's my family information, and then how do I share that with the right people when I want to share it?
Yeah, putting you in control really is the key. So I can upload documents here. We use RAG for this. So imagine that you receive a patient discharge summary and there's a whole lot of information there. You want to use AI to actually tell you a bit more about these documents. So I can simply Well, let's go back to the parent one, and I think we'll see it there. So the parent would be able to see. Um, ah, not sure what documents are not working there, but that's okay. That's fine. Something changed. That's okay. But the point is that when you have those documents, we've got things where we use AI to help explain things. So
Go
you can.
start again.
Mm,
Just talk about it. Don't worry about the fact that the document is there.
okay.
Just say, look, you'd be able to click here, and if you had documents
Okay.
there, you'd be able to.
All right. So another section that you've got here is a way that you can A, upload documents for yourself, your children, etc., and then B, use those documents. So for example, when it comes to doing tasks, sure, you can create administrative tasks like, I've got to do some healthy food stuff, get the kids to the GP before flu season, clinical tasks that you can add manually, things that, you might have been at the doctor and it says, get your blood checked, go to the chemist to do this. You can also use AI to help you generate some of this stuff. So if I choose a document here, I've got this one for myself in terms of my hypertension. In this case, I might say that I work on Wednesday, and there's a set of instructions here from this discharge summary or this managed plan. I say I work on Wednesdays, so can't do anything. Any visits on those days. So having an ability to add context to whatever the AI generates as the task that you need to do, as well as reading that document, I think is really key so that you have more of that empathic kind of care, not just when it comes to sharing your data with GPs and professionals, but also when it comes to how AI helps you too. So it says, arrange this, do this, book an appointment for sodium intake, this other scheduling, exercise, planning your reviews with your GP, any kind of concerns and stuff there. If I said when I did that something else like I can't do or I'm breastfeeding at the moment or whatever it is that you're going through, because the story that we had was that when there wasn't this kind of stuff taken into account, that Sal had, just gone through childbirth. It's only been a few weeks out and had like back pains, and they didn't take into account that there's children at home, for example, for the thing that they need to do. That's going to be a problem. And then if you generated the task, you would see that here on screen. But the thing is, you can actually share those tasks.
Yeah.
So in this case, let's go to Oliver. Oliver has some tasks. I could select all of these or just certain ones, share that with a GP, and I can actually, I would be able to see as a GP what these tasks are, add notes and approve things. So having like a two-way kind of conversation without the need to always book is one of the things that we see as a future of
It's an important way of keeping both human in the loop and also validation from the actual practitioners themselves, so
Yeah.
that we don't want the AI to be making things up. It has to pull specific information from a validated, provided source. So when you're creating these tasks, it's not like the AI is going, oh, you should do this. You're just going, okay, you've done, these are the tasks we've said, but you said you can't do this particular thing. Shift it out by this particular point to ensure that you don't miss it. Like
Yeah.
as the practitioner is giving you that advice to do it in the first place.
Exactly. And then the next thing was that we also created like a symptom checker. We're looking in the real app, this is just for the hackathon, to integrate into things like Health Direct Symptom Checker, where you actually put in your details. It's got your profile, but you have to input that each and every time. In our case, because we've got a profile already, when we do a symptom check, it already takes into account your profile. You could put in details of there about like, what are the first things you're feeling? This is a very similar experience to what you have with Health Direct. The assessment in this case, instead of going to the APIs and all that kind of stuff that we would have in the real app, in this case, we're actually just using AI to generate the next couple of questions. What's my pain like? It's a 9, right? I didn't say if it's constant or intermittent, but it's using AI here to go through and create actually the next set of questions. So this is done on the fly generatively, but we would do this in a more deterministic kind of set pathway in accordance with, what a Health Direct initiative. So
Yeah.
we want to integrate with different tools as well, but adding these kinds of easy to use kind of features is really key for this, because this is going to go into the hands of patients.
Exactly right. And even though we are using, again, it is AI that is helping to structure these things. It is structuring it from official sources, government approved and health approved sources. It's not, pulling from random content on the web from an AI standpoint. So the accuracy and the relevancy to particular patients is something that is health approved.
Another thing that you would be able to do, and I showed it there where the user upload documents, is that we use it in the appointment setting and scheduling a task, but you can actually interrogate that. So you'd be able to select documents here, use the AI to talk to that and get a better understanding in an ad hoc way about what was meant in certain health related documents that you receive. And we're going to be expanding on more of that in the future.
To allow the user to better understand what is going on. Sometimes you get these documents and it's filled with this language that's really hard to comprehend. You might not understand it. You're overwhelmed in this particular time, and now you can use these AI tools to support you with the information and data that has been provided. And again, it's not suggesting new things or changing it. It's just literally helping you to understand what has been provided.
Exactly. And then the final thing to show is just, we built this with Bolt. You can see the Bolt sticker that's on there.
Love it.
This is one of the apps. So this is the patient app. I've got a whole heap of code that sits here behind the scenes. So when you're building React type applications, and yes, you can use Cursor, Windsurf, blah, 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 Codex, whatever all these other tools are. What's great about Bolt is that they actually provide a one-stop shop for you to actually create the code, interrogate it, do manual changes if you want. So I can click into some of the components here, see the code. I can do the manual changes if I need to, use other tools, or I can use Bolt. You've got a certain number of tokens depending on the level that you're at. So you've got to be cost conscious when it comes to that. But the key thing is that when I want to deploy this, it's connected to my GitHub. I can click deploy. It will publish it to a site called Netlify, where I publish many other things as well. And through Netlify, you'll be able to control what the public sees. So really interesting stuff. You can also export and download the code. And it was just really useful having this one-stop shop for all of this kind of stuff. So I think that was a real key thing for me.
Nice. Thanks for checking out our new tool. Hopefully it's going to become something bigger and better in the future.
Watch this space.
Yeah, watch the space. We'll talk more.
Cheers.
Circuit board buzzing, worldwide, tech trends blazing, digital fire. AI, rising to the sky. Digital world, we reaching high.